morning. I'm Dr. Epstein. I'm going to be talking today. I'm going to be working on a patient today who's had a procedure done back in around 7 years ago. It's an Asian gentleman. I want to talk about some of the subtleties of doing work on an Asian patient. And typically those subtleties have to do, if you take a look, is the coarseness of the hair. Obviously, when we use the term Asian, it covers a wide variety of ethnic groups, but there's an overall tendency for Asians to have very coarse hair. The individual hairs tend to be thicker. Each hair tends to be thicker, and the spacing between the follicular units tends to be wider. So what you can see here is we have straighter hair, and if you look closely, and I've already trimmed his hair. Now, he had a prior procedure. You can see the fine line scar from the other surgeon who did a nice job. You can see the spacing between the follicular unit, but each follicular unit happens to be thicker. It may only have 2 hairs, and the majority of follicular units with Asians tend to have 1 or 2 hairs. Occasionally we get a 3-hair patient, especially those that have a mixture of ethnicities. But with the classic Asian, we're talking about typically 1 or 2 hairs. And it's very important to achieve a natural result that we don't artificially combine those follicular units, that we keep and we transplant 1 and 2 hairs individually. It does mean that the density is a little bit less. However, we can compensate for that by placing the grafts even closer, and the fact that we're able to use such small recipient sites, 0.5 to 0.8 millimeters, means that we can place these grafts even closer. But if you combine the follicular units, you can get somewhat of a pluggy appearance. And you can see that, up here, where we're going to go ahead and work on this patient, you can see the line that I've marked out. He's had his prior work, and you can see it gives the appearance of density. And you can see the where the spaces we're going to be working in. Very important to have forward angulation of the hairs. And what we're going to be doing on this patient, who happens to be 42 years old, is we're going to really be concentrating up here. But in addition, we're going to be providing some coverage in the crown region. And you can see this is the area we're going to be filling it. The goal today is not to give him a thick crown, but just enough to provide some degree of coverage, so it's not a bald crown, and he understands that what we're going to be doing on that. To get as many grafts on this patient as possible, in addition to doing the strip, you can see I've marked out these areas, these blue lines. This is going to represent an area where we're actually going to do FUE grafts as well, or follicular unit extraction. So we're going to remove the strip, and then using parts of the scalp, the donor area, which is good hair that's not included in the donor strip, both above and below the actual donor site incision, we're going to be doing follicular unit extraction, 0.8 millimeters to extract individual follicles. I anticipate being able, or individual follicular units, I anticipate being able to get, in addition to the 2,300 or so grafts from the strip, we can probably get as many as 300 to 400 FUE grafts on top of that. We'll see how that goes, but that's the goal. So the goal is to get hopefully as many as 2,700 grafts, and we'll see how that works. But he should do well. Thank you.